You've heard from Minister Gan earlier about the important role that testing plays in diagnosis, in active case finding and surveillance. I'll just touch a little bit on the part that we are doing with regard to monitoring and protecting our essential workforce. We are starting to test more regularly workers in the essential sectors, particularly those in vulnerable or working in vulnerable areas. For example, the staff in our nursing homes, as well as our healthcare workers and frontline officers who come into close contact with confirmed cases. So we want to do this to ensure the well-being of our essential workforce and also to protect seniors and vulnerable members of the public. Each time we do these tests, it will help us to detect early and also to prevent any clusters from forming through these early detection. And as Minister Gan said just now, this aspect of testing is critical, particularly as we plan for a phase beyond the circuit breaker. Eventually, we will want to gradually relax our restrictions as our community cases come down and resume activities. This needs to be done in a safe manner without us risking new infection clusters from forming. All countries are grappling with this as they move out of their lockdowns, relax measures, how to go about doing this in a safe manner. And the key enabler for this is really to have a scaled up testing capacity. And that's why we are ramping up, scaling up our testing capacity, not just doing this with existing PCR tests, but also looking at new technologies that might be available, including potentially point-of-care test kits that can be scaled up more rapidly. This capability to ramp up, to build up more testing capacity is critical as we seek eventually to resume and restart our economy. But an important point to note is that testing, while as critical and important as it is, cannot be a substitute for personal responsibility and safe distancing measures. So we go back to the fundamentals and ask everyone during this period to stay home, uphold good personal hygiene, and for those who are in the essential workforce, even as we start to test more of these people who are working, anyone who is now in the essential workforce should still continue to take precautions, meaning to say, as they go to work, minimize contact with their colleagues. Don't go to work and then end up socializing during lunch break or during break times at the pantry or outside the workplace. Right? Minimize all contact, go to work, go back home, and if you're not feeling well, it's critical, don't go to work. Right? Ensure that you do not have symptoms or even mild symptoms and then go to work, end up transmitting potential infection to your colleagues. These are reminders that we have been telling everyone, and it's very important that we all continue to uphold these very basic precautions and safeguards together with a ramped up testing regime. So testing cannot substitute for all of these. Remember, even when you test, it will not be 100%. There is a chance that you can test negative, but you are in the incubation phase. And so that test will not pick up the virus during that phase. So all of these things have to be done as part of a holistic strategy in order for us to slow down the spread of the virus and ultimately defeat COVID-19. Thank you.